Hello, HHT community, and welcome to our latest webinar. Today, you will have the opportunity to learn all about how you can be an HHT Changemaker today by participating in two of our newest research projects. My name is Riley Blevins. I'm the Senior Director of Global Community Engagement here at Cure HHT, and I will be moderating tonight's session. But before we jump in, I first want to make you aware of some exciting news and announcements. First, we're almost at the halfway mark of National HHT Awareness Month in June, which is an important fundraising period here for the foundation. This year's campaign theme is HHT Changemakers, and we're inviting everyone to join our community of changemakers with a gift today. In all transparency, we still have quite a bit to go to hit our goal of raising $200,000 this month, so please consider giving generously if you can. No gift is too small, and we mean it when we say every dollar truly makes a difference in our fight against HHT. Also, for those joining us for this webinar, I have a little tease for you all. Stay tuned to our emails and social media channels next week, as we'll have a special fundraising announcement ahead of Global HHT Awareness Day on Sunday, June 23rd. You won't want to miss this one, so please do stay tuned. Also, there are more than one ways you can become an HHT Changemaker this June. We'll have another webinar later in the month, so please consider registering for part 2 of our Changemaker series to learn how you can get your local providers more educated on HHT for free in our upcoming continuing education program. This is a new online platform we've launched in an effort to further educate non-HHT providers about the disease. Please join us and do learn more. Our webinar today is brought to you by BleedCease. Stop bleeding fast and easy. Click the link in the chat to receive a free sample pack of BleedCease. We thank them for their generous support and partnership this June. Also, we are excited to share our 15th HHT International Scientific Conference will be held at the Pullman Mandalou Bay and Mandalou Lana Pool, France on October 15th through the 19th, 2024. This conference is one of the most meaningful ways we advance treatment and care within HHT. It fuels innovation and sparks collaboration amongst the world's leading physicians, researchers, and scientists. Registration is now open. I will divulge, we are set to break some records at this conference this year in terms of abstracts, posters, and oral presentations. Cure HHT, we continue to grow the medical community who is focusing on this disease, which ultimately impacts you, the patients. Next, as you will hear more about today, participating in research is perhaps one of the most meaningful ways you can contribute to a brighter future for our disease and all of its patients. We just expanded the criteria for our newest clinical trial, the Pazopanib study. Check out our website for more information and to see a recording that will help answer all of your questions about if this study is right for you. We have several research projects underway, and you can learn more about things like the Brain Vascular Malformation Consortium and tissue donation by visiting the research section of our website. Finally, before we get underway, I want to go over some housekeeping rules for the webinar to make this event as interactive as possible. If you have a question for the presenters, please type it into the Q&A box in the right of your screen. We recommend that you keep your questions general in nature so they benefit everyone. I will ask as many questions as time allows. We will post resources relevant to tonight's topic in the chat box. You can use the chat to make comments to either an individual or to all participations in the webinar. But please do not post questions for the presenters in the chat box. All questions should be typed into the Q&A box. This presentation, it's also being recorded, and that recording will be saved in the Cure HHT website's resource library. And at the end of the discussion, you'll be emailed a brief survey. Please do take a minute to fill that out. Your input really is critical in developing future webinars that are impactful for this community. And with that, let's officially get underway. It is my pleasure to introduce you to tonight's speakers. With us tonight, we have Dr. Cassie Friday, who is the Director of Research Programs and Grants at Cure HHT. She joined our team after completing her PhD at the University of Kentucky. Cassie is also a caregiver for her husband and 2 of their 3 children who have HHT. With us tonight, we also have Courtney Kasturiarachi, who is the Patient Education and Registry Administrator for Cure HHT. She joined our team after finishing her MPH at the University of Pittsburgh, where she studied public health genetics. She started out as an intern with a passion for HHT and now runs our patient education programs and patient registry. you're on one of our patient education programs, you'll hear more about our patient registry. So thank Courtney for her hard work. At the end of their presentations, we will hold a 30-minute moderated Q&A session, so please do get your questions answered and use that chat box. With that, Cassie, I'll turn things over to you.
Thank you so much, Riley. Get my PowerPoint up here. All right. So thank you for that introduction. I am very, very excited to talk to you about the at long last Cure HHT BioBank, where we will be collecting normally discarded tissues that just go into medical waste and using them as research to drive research towards a cure and better treatments for HHT. So for this talk, I'm just going to go through the normal who, what, where, when, why, but in a little bit different of an order. So we'll talk about what the biobank is, why these tissues are so important, who is eligible to donate tissues, and who the tissues will go to, where the biobank is held, and also when it's appropriate to donate tissue. And maybe the most important question is how you can donate tissues if that's something that you're interested in. So the Cure HHT BioBank collects, stores, and distributes biological specimens for scientific research. That's kind of the overall gist of it. What can be donated in the biobank is really a lot of things. So as we all know, HHT is a disease that affects the blood vessels. But because you have blood vessels all throughout your body, pretty much anything that is affected by HHT can be donated to the biobank, including blood or things that have genetic material that could give information about why your blood vessels are not forming properly in the first place. And so this can include things like blood, saliva that has those genetic material and information within them, or biomarkers that can help us learn more about signs that could be monitored over time to measure if a treatment is going to be effective or not. Skin telangiectasias, so those little red dots on your fingers or your lips, if you ever get any of those removed through a punch biopsy at the dermatologist, those could be donated to the Cure HHT BioBank. Any tissues that are removed during surgery. So if you have an arteriovenous malformation in your brain that is being surgically removed, or if you're having part of an organ taken out, or maybe an entire organ for transplant, or maybe you're having a hysterectomy, those tissues can be donated to the Cure HHT BioBank. Any transplanted organs, as I just mentioned, sometimes there are lung or liver transplants that take place for HHT patients. And then we also will accept postmortem donations. So why do we need a biobank for HHT? So this is something that researchers have told us that they need the most for a very long time. And we are finally able to make it happen, which we're very excited about. So the importance of a biobank is really for many reasons, which I'm going to list and kind of explain a little bit more right here. But we know that HHT has a lot of variability. Like Riley mentioned, I have my husband and 2 of our 3 children have HHT. Everyone in my husband's family with HHT presents a little bit differently. Some have AVMs in their brain, some is in their gut, some have a lot of nosebleeds, some have very little, some have lung involvement, some don't. So why do we have such great variability in HHT? That's something that we need to understand better by looking at our genetic information. And we can do that by studying both the genetic sequences of the blood and the HHT lesions themselves. And then we also don't know very much about HHT in the liver. There are actually quite a few people with HHT who have involvement of vascular malformations in their liver. It's about 60%, but only about 10% of those have symptoms that can affect their heart or cause right-sided heart failure, or what we call high output heart failure. And we don't really know what the difference is between those who have symptoms that develop and those that don't. So looking at liver tissue from HHT patients could help us understand that more. And then we really are just starting to scratch the surface on what's going on with women's bleeding in HHT. This is something that has been studied by the team at the University of North Carolina, and they are looking at, maybe many of you have taken a survey if you have seen Cure HHT post a survey about women's health and bleeding. And a lot of HHT patients seem to have heavy menstrual bleeding, and that could be because of uterine AVMs. And so maybe a higher incidence of hysterectomies, and having that uterine tissue to look at after it's been removed can help us kind of shine a light on if that's true or not. And then pulmonary AVMs, how fast do they grow? We know we monitor them over time with bubble echoes, and then we kind of have to wait for them to grow a certain size before we can go in and treat them. But some of them grow slowly, some go a little bit faster. We don't really know what drives these and what drives the formation of them in the first place. And sometimes they seem to cluster together. Sometimes they're very big, and then sometimes they're very small and they're diffuse throughout both of the lungs. And we don't really know the differences about why. And then brain AVMs. Riley had mentioned the Brain Vascular Malformation Consortia. This study has been ongoing for close to 15 years now, and they're also collecting tissue from people who have HHT and trying to understand the risk of people who have brain AVMs in those AVMs rupturing and causing a hemorrhagic stroke. And then we also need human tissues to establish cell lines to screen different drugs. So we want to know what therapies are going to work to prevent these vessel malformations from forming, and also to reverse the ones that are already there. And we do have animal models for HHT, but they're not completely the same as a person. No animal models are perfectly the same as a human for a disease. And because of the genetic variability in HHT, really studying human tissue from HHT patients is the best way to go to advance research forward. And then, of course, through genetic sequencing, we can also identify mutations that haven't been discovered yet. So many people who have HHT and they've done genetic testing may have an inconclusive result or a variant of unknown significance. The more that we sequence tissues and learn about the different genetic variants and mutations that are out there and match those to your medical history or your symptoms or the information that Courtney's collecting through HHT Connect, we can understand and identify mutations that haven't been discovered and add those to our testing panels for HHT, and then we can diagnose more people, which is always good. Anyone can donate tissues who has HHT, and then we'll also be interested in accepting tissues from people who are family members of those who have HHT, but they don't have the HHT causing mutation. I'm probably not ready to accept a lot of donations from family members without HHT yet, just because we're in the early stages of our biobank, but this is definitely something that I'm interested in the future. And if you are a family member of someone who has HHT who is donating to the biobank, and you would also like to donate as well, then definitely please let me know. We would like to have those kind of matched. It wouldn't really do us a lot of good to have people without HHT, the HHT causing mutation, without their family member who also has HHT donating tissues, because we want to get sort of a direct comparison. And then just a few examples of some of the researchers who would be receiving tissues or who currently study human tissues in their labs. Dr. Doug Marchek, he is a professor at Duke University, and he really works on looking at the different thematic mutations or kind of secondary mutations that might occur to start an AVM or to drive the rapid growth of an AVM. And learning about why that happens can really help inform us, one, about how HHT works and why AVMs form sometimes and don't in other times. And then also that can help us pick better therapies to test in the lab. And Dr. Bailey in France, she's one of the co-chairs for our scientific conference this fall. She really works on studying the ligands, or kind of the very starting signals of the signaling pathway in HHT that gets messed up whenever you have a mutation. And so she would be studying tissues to look at how to restore that signaling pathway, and which therapies would best do that. And along the same lines, you have Dr. Strider Meadows at Tulane. We just got some skin telangiectasia sent to him. He typically works with mouse models of HHT, looking at different aspects of the signaling pathway that can be restored through different therapeutics. And he wants to compare that to human tissues to see if what he's doing in the mice would be something that would be possible to put into a human trial in the future. And Dr. Wasu at the University of California, San Francisco is working on something similar, where she's also trying to identify new targets for developing specific therapies for treating HHT. So not just therapies to treat the symptoms of HHT, so to treat bleeding or anemia, but these are targeted therapies to cure HHT, to restore the signaling pathway and reverse the formation of the AVMs that are present and prevent the formation of AVMs that happen in the future. And they need human tissues to really fully understand how they can go about doing that. And, you know, the people who receive the tissues, again, those are just a few examples of our many, many researchers around the country and the globe. We have a global network of researchers who have access to this biobank, and they'll submit their proposals and their request for tissues that they need. So they need to have hypothesis-driven research already planned out, and they need to let us know what tissues they're looking for and what preparations they need. And then we have a governance committee that will review those proposals, and you know, just to make sure that they're valid and they have a good plan for those tissues. And very importantly, we also need to make sure that what they're proposing is, you know, the number of tissues they're requesting is statistically significant enough to yield good results. You know, for example, we wouldn't want to accept a proposal that maybe is a really great idea, but they're not requesting enough tissues to actually get valid data to come to a worthwhile conclusion that could be meaningful to advance the field in a confident way. And so those are the reasons that we have a review committee to look at those proposals, because we know how valuable these tissues are, and we want to make sure that they're going as far as they can to advance this field. And then those tissues are shipped to those researchers. And they're shipped from Boston, where our biobank is held in the lab of Dr. Andrew Liss. And he is not an HHT researcher. So Dr. Liss is actually a professor of surgery at Harvard Medical School, and he works with pancreatic cancer. And he does a lot of biobanking for his own research with pancreatic cancer, but also for several other rare disease foundations like fibrolamellar cancer. We were connected with him through our networking through the Chan Zuckerberg Initiative, and we contracted our biobank with him earlier this year. And so they just have a vast amount of experience in biobanking, and they have the space and the expertise to do everything that we need. Again, because HHT is such a diverse disease, there are a lot of different tissue types that could come in, and we need someone who's able to handle pretty much everything. But you can donate tissues after a planned surgery, or maybe when we ask for volunteers. So we had a patient conference earlier this year, and we asked people if they wanted to donate blood. And we had 38 people donate blood right on the spot, which was absolutely amazing. And those went straight to the biobank. And then you can also set up a postmortem donation. And I know that this is kind of a morbid topic for some people, but if it's of interest to you to donate your body to science or to HHT research, it is absolutely critical that you plan that out and write down your plans, or let someone in your family know about your plans. because if people know, or if we have advanced knowledge, then we can absolutely make that happen, and we can make your last wishes absolutely come true. And it's a great legacy to leave. But if people don't know, then it may be a little bit tricky. So the more time we have to prepare, even if you're going in for surgery, if you can let us know, then we can get everything set up. All you would need to do is sign a consent form, and we handle everything else. So how you can donate, you just let us know you're interested. We'll send you a username for our Study Tracks portal where you can view this consent form. And of course, we'll go over the consent form with you. You can ask any questions, and then you can sign it digitally, or I can mail you a consent form if this is not accessible to you. And then you'll answer a few questions about your health, and then you can celebrate because you did something really awesome for HHT research. And I just can't say enough how thankful I am because of my 2 children who have HHT, and I know that they're going to have a better life because we have so many people studying this disease now. And so I think it's a really exciting time. So you can email research@curehht.org. If you wouldn't mind to put biobank in the subject line, that might be helpful. You can also learn more on our webpage, or you can always give us a call. And if you have any questions, we're here. You can email me directly or email the research email. I'm happy to sit and talk with you, or if you're hesitant about it or want to know more, always happy to talk, and just anything that you need. We're very excited about this opportunity, and if it isn't for you, then it's not for you, and you don't have to feel bad about it. But if you want to donate tissues, then we will certainly take them. Thanks.
Thank you for that, Cassie. Courtney, I'll pass things over to you.
Thanks, Cassie, for a great presentation. I'm always interested about donating tissues. I don't know about you guys. Alrighty, now on to our next research project, HHT Connect. I have been working on this project for the last 3 years, so I'm very excited to finally give the community a little bit more information on it. So what exactly is a patient registry? A patient registry is a collection of information from patients who share one condition, and it's used for a lot of reasons, mainly to help develop therapies, guide medical treatments, and inform the patient and medical and research community. So we start with the patient registry. We collect information from you on your background, your personal experiences with HHT, your treatments, medication, and the really important stuff that you can tell us about: quality of life, how you're doing on a day-to-day basis, how much HHT impacts your daily life, and is it a problem, and how much of a problem is it? And then what we do with that data is we look for connections. I will not be doing the primarily, like, a lot of the data analysis on it, but we will be compiling this information and giving it to researchers who request it in a very similar way to how Cassie has a governance board. We will also have advisory committees, and they will review the proposals and then give the de-identified data in a lump sum to those researchers. And they're looking for these greater connections, and so then we give them to the scientists and doctors who will use them to hopefully find any statistically significant patterns, and that can then help develop new therapies, see what's working, see what's not working, and then that'll in turn come back to you, the patients, and make your life better. The more we know, the more that we can help you. And so why is this so important, and why is a patient registry itself so important for the community? The purpose of HHT Connect is we would love to reach as many patients globally to participate. I know that a lot of our stuff primarily takes place in North America, but this study specifically is for everyone internationally. We can't accurately update HHT facts like average age of diagnosis, the breakdown of race and ethnicity, or the age of HHT symptoms onset until we know from as much from the population as we can. Some common questions I'm going to answer for you guys: who can participate? So who can participate? This registry is open to anyone who has an HHT diagnosis and meets the inclusion criteria, which would just be that if you yourself have HHT, you are a caregiver of HHT to patients under the age of 18. So Cassie would be a caregiver, and HHT patients that have passed on and their primary caregiver is willing to answer a smaller subset of questions. And so there are two types of accounts that you will create. This platform is completely online. You can do it on your phone or on your laptop. And the two types of accounts are a participant account or a caregiver account. If you are an HHT patient yourself and you have children that have HHT, you would select a caregiver account and you could answer questions for yourself and for your children. Next question: is there a cost? You really just need to have access to a mobile device or a laptop. I will say it's probably easier to do the questions on your laptop because you can see more of the questions. And then what information are we asking for? We're really just asking the basic sociodemographics, your basic medical history, what you would answer most of the time when you go in for regular doctor's visits, your HHT medical history, your HHT treatment on a very basic level. Just we want to know if any of your AVMs have been treated. And then we'll look at that information over the course of every year. We'll ask you the same questions in terms of your HHT history, and that'll give us a better idea of disease progression. And we also ask more questions about HHT care as well. We want to know if you're being seen at a center, if you're not being seen at a center, and how many ER visits do you have a year? And most importantly, again, quality of life. We want to hear what your experiences on a day-to-day basis with HHT. And there's validated surveys for that, and those are what's in the platform right now. And that helps us connect more and helps us as researchers because those are validated studies. Another question is, will there be more surveys to take? So initially we have, depending upon what your HHT manifestations are, we have between 8 and 11 surveys to start out with. Yes, we will be planning on adding more surveys in the future, but in terms of annually, we hope there will only be a few surveys that you would update annually. But you can go in at any point in time when you have genetic testing results to update, anytime that you have new manifestations, anytime that there's a change in your HHT diagnosis, you can go in and update that information at any point in time. Another really important question is, where is my information and data stored? So we are using the NORD I Am Rare platform. NORD is the National Organization for Rare Diseases. They have quite a few other rare diseases using this platform. And so they store their data on encrypted servers actually located in Canada, and they're backed up. And all of our stuff is GDPR compliant, and we are IRB compliant as well. And then lastly, who has access to your data? So the goal of this registry is to be able to use this information to give to researchers and scientists and doctors, and so we can learn more about HHT. All of the information that we give away will be de-identified. We want to protect you always, and that goes through, those proposals will go through a registry advisory board, and then they will be the determining factor of who gets the data. And most of the time, that data will always be de-identified. And the only people who have access to the data are me and some of our other registry staff and Cassie. Now, to get to the important part, how do you participate? You can go to our website, first of all, and then that'll take you to this link, hhtconnect.imrare.org. And then I'll run you through quickly the steps on how to get started, and it'll be good. So first, you'll create a password protected account. Again, there's two different types of accounts that you can create: a participant account if you're only answering questions for yourself, and a caregiver account if you are answering questions for yourself and your children, or just children, or on behalf of someone who has passed away with HHT. And then you'll read through these terms and conditions during registration, and then you'll hit next. And then you'll enter in your first name, last name, email, country of residence, all those good things. And then you'll be sent a verification link. And so this makes sure that you're not a bot, you're a real person, you're going to be entering this platform, and that your email is verified. Now, we have been seeing some people that have been told to contact the staff at this step instead of getting a link. So if that happens, you can just email me at hhtconnect@curehht.org. And I will hit up our Nord IT team and they will push you through. We have a lot of security measures in place to make sure that the wrong people are not entering the platform and that real humans are entering the platform. And so sometimes normal people get bogged down in that process, but if that happens, you can just email me and I will be happy to fix it right away for you. Once you get your email validation, you'll then set up your password. And I will note that password generators do not work with this platform. And so it'll flag you as a bot because of that. And so you have to hand make your password, but after that, you'll be ready to go. And then you'll log in using your new email and password. Then you'll add a new participant. This could be you or your child if you're a caregiver or someone who's passed. Then you'll add your participant. You'll go through this nitty-gritty of your first name, last name, name on birth certificate, date of birth, country of residence, country of birth, and I'll get into a little bit why we ask all of those questions. Then you'll complete your consent. This is the next important part of the research process. This is just to make sure that you know that your data is being stored, that it is safe and it is secure, and that there are no risks to participating in this study. And you can scroll through, you'll read through the entire consent, and consent can be revoked at any time. If you don't feel like you want to be answering these questions anymore, you can change your mind at any point in time. We also have this option here to opt in to have more communications. So anytime that we have studies that come up over the next few years, you'll be the first ones to know about them, like any new clinical trials, anything that you would be eligible for, or any information from the foundation. And then step 3 is complete all of your surveys. And you can take as much time as you want to complete these surveys. It will periodically save for you, and you can hit save when you're in your survey on your laptop, and it will save, and you can come back to it at any point in time. And I send out reminders to participants every 2 weeks to get you to finish those surveys. And then that's it. And you might have heard about some of our other research projects. So I'll just click through this, which clearly we're talking about the biobank here. And we also have this other project called Chorus. So Chorus is another registry that you may have heard about, or you may not have heard about, but that is another registry that is launched at 15 out of our 30 North American Centers of Excellence. Now, that study requires no patient participation. You consent when you're in clinic, and a research coordinator will take your data from your medical records and inputs it into a database. And for the biobank, as Cassie explained, we ask for your samples from surgeries, blood donations, and so we can get those samples to basic scientists. So all 3 of these registries allow us to create a unique identifier. That's why we ask those questions at the beginning of the process that goes over your first name on birth certificate, last name on birth certificate, data that doesn't change. And that allows us to create this thing called the Global Unique Identifier. And it's essentially a series of numbers. And that way we can connect you through all 3 of these studies, which gives us pretty much a full picture of your HHT health. And that's why in HHT Connect, we try not to ask you too many questions about things that your doctor could answer or things that we could get through this Chorus registry. The only thing is we know that that's not open to everyone. So that's why we created HHT Connect, in order to have the global HHT population. And then this is the link, but if you just go to our website, it's at the top of the website. And then I'm happy to take any questions, and I think we'll get back into that now.
Thank you, Courtney. Thank you, Cassie. Hope everybody with us enjoyed those presentations. It's question time now. So if you do have a question for either Courtney or Cassie, please do drop it into that Q&A field. We'll get to as many as we have time for. We have a few that were sent along in the registration process, so I'll get to some of those first. starting with an important question, which is, so how do both of these projects actually help us make progress towards a cure?
So I'll go first. I think I mentioned a whole bunch of them on the one slide with, there are many things that we know about HHT. We've truly come such a long way. We know that many of the genes that cause HHT and the basics about the signaling pathway and what goes wrong. The things surrounding how exactly AVMs form and why there's such great variability between members of the same family with the same genetic mutation, and sometimes, risk of rupture or how fast an AVM may grow, or how stable it may be. Those are the things that we really need to figure out, and studying the tissues and learning more about biomarkers and things can help us learn more about those gaps that we have in our knowledge. And also we can find better endpoints for our clinical studies so that whenever we create better targeted therapies to treat or cure HHT, we have better clinical measures to monitor to see how those things are progressing over time, so that we can effectively measure those and get more therapies approved for HHT patients.
Thanks, Cassie. Courtney, you have anything to add to that?
No, I let Cassie handle that. She is also the PI for HHT Connect as well. Hence why she's our director of research.
Sounds good. I will say on behalf of HHT Connect, when you have the opportunity to advance Cure HHT research and do so from the comfort of your own home, I strongly encourage everybody to take advantage of that. That's a pretty low bar that goes a really long way. Another question we have that applies to both studies here is this open to international patients?
Right. So for the biobank, right now I'm accepting tissues from the US and I'm giving tissues to researchers internationally. I hope to have an international biobank location. However, the regulatory processes and the material transfers of biological specimens, regulations vary from country to country. And so we just needed to start in one place, and hopefully we can expand as time goes on. But there are researchers in many countries, in Europe especially, who are studying HHT tissues when they do get them from surgeries just at their local site. But I will say the reason that we want the centralized biobank, like what we've developed with Cure HHT, is that when you have a researcher who's studying tissues that are available just from patients seen at their own center or their own institution, you're not getting that geographic diversity that could be important in understanding some of these things. And you're also not getting as many tissues and sometimes not as quickly as you could if you were leveraging someone like Cure HHT, who's connected globally to thousands of patients.
Thanks, Cassie. Courtney, is the registry open for those outside the US?
Yes, this is a global HHT registry. We currently know that HHT affects all races and ethnicities equally. So we want to make sure that we can get as many HHT patients globally to submit their data. We are working on language translations as well, because I do know that that's a barrier as well. So we're trying to get that up and going too, so that people in other languages can also fill out these surveys and understand them. And exactly what Cassie said, we don't know about geographic location, and that could also affect HHT, which it does because of environment. If your environment is different, you might get more nosebleeds and more frequent nosebleeds. So if we have that information, we can just have more patterns and clues and connect them.
Sounds good. Thanks, Courtney. HHT is certainly a complex disease. It affects different patients very differently from one another. So we really do need as many community members as possible to join the registry and complete those surveys. Looks like we have a question in the chat for you, Courtney, which is, can you register as a caregiver and then again as a patient?
So initially, you will just create one account. You will have one account and you can have multiple participants under one account, and you will hit a caregiver account. So you don't need to have two different registrations. You will have to go through the consent process as met for every single participant that you add. So Cassie, for example, would add her husband and both of the kids. And so she would have to go through 3 different, 1 consent and 2 LARs for that. Happy to always state that again.
Thanks, Courtney. I think I'll end things with this. Why are both of these studies a significant milestone for us at Cure HHT? Cassie, what would you say to that one?
Oh, man. I mean, we've just really exploded in the last couple of years, right? I mean, Cure HHT has always been a fantastic organization, but I mean, just to think, 5 years ago, there weren't clinical trials for HHT, and now we have several, and we have so many more researchers who are studying this disease, and the need to move from mouse models into human tissues is amazing, right? Just that is progress in and of itself. And they can't really do that if there's a lack of human tissues to study. And so just that we're at this stage represents the growth that's occurred. And I think it's just going to be a catalyst for more understanding and more therapies coming out.
Sounds good. Thanks, Cassie. I did lie about that being the last question. We have one more in the chat here that I want to get to, which is about BioBank postmortem donations. The question is there any kind of template or document available that can be easily filled out with other end-of-life wishes?
Yes. So we actually are partnering with another nonprofit organization called Anatomy Gifts Registry. And so if you're interested in doing a postmortem donation, in addition to letting your family know, you'll set up through Anatomy Gifts Registry. And we're hoping to partner with a couple of other organizations, just depending on where you live in the country, just so it's a little bit easier logistically. But this organization is absolutely fantastic. They cover all costs of crematory services after, and they're just a really fantastic group of people to work with. And they help you plan everything. They get all the proper documentation, and then they would go and work with your family afterwards, and then give everything that they can to the Cure HHT BioBank, which would go straight to Cure HHT researchers.
Thank you, Cassie. And thank you again, both Cassie and Courtney, for your time here today and your thorough presentations. I think Cassie said it really well. Cure HHT research and advancements within this disease truly is exploding. But the reality is, if we want to create the type of change all of us as patients or caregivers want to see, it's up to us. It's up to all of us as community members and patients to make that happen. You might be asking, how can I make that happen? There are more ways than one. You can complete the registry. You can donate tissue to science, or you can donate today as part of National HHT Awareness Month. Every dollar truly does make a difference. And when we say donations save lives, we truly mean it. So thank you for being with us tonight, and thank you for your continued support. Have a nice night, everybody.
Thank you.
Bye.